request the last presenter, Dr. M. SHIRAZ Ali from Ranchi, will talk on future perspective and recommendation for improving quality of postgraduate training. Dr. SHIRAZ.
Thank you, sir. A very good afternoon to each one of you again. The aim of medical education is to produce doctors who will promote the health of all people, and that aim is not being realized in many places, despite the enormous progress that has been made in the biomedical sciences. This article by our own AIOS stalwarts presents the feedback of training of those who were trained in the last decades of the 20th century and compares it with the feedback of training imparted in the first decade of the 21st century. Almost all clinical skills, teaching, and exposure to investigations had improved over the past decade. The 20th century trained cohort reported only refraction, diplopia charting, synaptophore as being taught better than the 21st century cohort. It was also found that in the present scenario, both independent and surgeries performed under supervision were less. Exposure to cataract surgery was adequate but not uniform, and SICS was the most common cataract surgery taught. The median for strabismus surgeries, RD surgery, vitrectomy, and keratoplasty was 0. Glaucoma surgeries, pterygium excisions, SAC surgeries, and eyelid surgeries had declined in number in residency training. So numerous educationists and academicians have recommended varied strategies for improving the quality of residency program in India. The shortage of medical teachers in higher education is because only those teachers defined as per NMC and NBA guidelines are recognized to train specialists, and their numbers are quite limited. There are a number of well-qualified and competent specialists, including in the private sector, as well as in the public sector hospitals like railways and defense, who could be considered teachers. Creation of an appropriate body like a teacher's accreditation cell could ensure continued evaluation of the teaching outcomes and maintain quality through recertification and continuous professional development programs. There should be adaptation of a standard common curriculum across all medical colleges in India. Curriculum is a dynamic and flexible document which should be responsive to the changing needs of the functions that a doctor has to perform in his or her community. It has been recommended that the postgraduate residency program should start with an induction training of at least 2 weeks, so as to sensitize the students to the versatility of the field of ophthalmology, and also it will familiarize the student to the institute and to the various departments. There is a need for formulating a manual which would explain the course objectives, and the term-wise curriculum provide guidelines to proceed throughout the course. And this will also tell the students what is expected of them at the end of each term and at the end of completion of the course. There should be a good learning resource center, including a good library, and acquiring administrative skills is another important part of training. Competency-based teaching has been applied to undergraduate medical education in India in 2019 and recently been applied to postgraduate training also. So this type of training focuses on the development of competencies required to fulfill a patient's needs in real life situation. And this type of learning focuses on the continued training of the student until the competency is achieved. This editorial published in IGO, here the author has suggested the incorporation of the 6 ACGME competencies into the residency program. The COVID-19 pandemic has shown that technology can be used across all healthcare sectors. A course on technology should be incorporated into the curriculum so that the students are up to date and can apply it in their clinical practice. A course on available technologies like robotics and artificial intelligence should form part of the curriculum. and a distance learning mode should also be incorporated. The COVID-19 pandemic has also has led to a wider use of virtual learning across all academic sectors, including medicine. Although it requires resources, this benefits students because they can learn and relearn at their own pace, at their own convenience, and at their own convenient work or study location. And these lectures become increasingly powerful when used with the flipped classroom model, an effective strategy that is widely used in the Western countries. Virtual learning also includes use of interactive technologies like polling features and gamification strategies, which increase the student engagement. Simulation-based studies have been quite popular in the Western countries and are revolutionizing the medical teaching. Simulation-based studies can help in early acquisition of complex clinical skills, increase the importance of patient safety, and reduce patient dissatisfaction as being practiced on. So the students should be told time and again that the number of cases doesn't matter. Doing with good understanding is more important. The flipped classroom model is a type of instructional strategy and a kind of blended learning which aim to increase student engagement and learning by having the students complete their readings at home or at their hostels and work on live problem solving during class time. To reduce the number of students, which is one of the causes of lower standards in medical colleges in India, it has been suggested that medical colleges be broken into satellite campus or new campuses. This will also upgrade the health services of a neglected geographical area. There is inability of fresh postgraduate students to work outside the setting of a large hospital where there are no sophisticated diagnostic and treatment facilities. Since majority of the postgraduates will practice outside the setting of medical college hospitals, a major part of their training should also be in settings outside the medical college hospitals. Trainees should be assigned to a chief mentor and also to other mentors also for overall personality development. And trainees should be provided opportunity to undergo short exchange periods by way of externships at institutes of excellence. So the medical education system needs to empower the trainees to learn and practice in line with geographic, socio-cultural, economic, technological, and behavioral patterns. Interprofessional education is another practice educational strategy which often combines with medical students with members of other healthcare disciplines, including but not limited to students and faculty of other specialties, nurses, nursing students, social workers, pharmacists, clinical laboratory technicians, and administrators. Traditional medical teaching imparts theoretical and practical knowledge of diseases and their management, but soft skills like professionalism, ethics, and communication are not formally taught. A training in soft skills should form part of the curriculum. This article was published in IGO by Dr. Purvi Bhagat Madam and all. She's here. And the purpose of this study was to assess the need for teaching communication skills to ophthalmology PG students and develop and introduce a module for the same. In this study, 99% faculty agreed that learning communication skills can be helpful in professional and personal life. 96.3% faculty opined that students make matter worse while trying to resolve a conflict with a patient, and 74.1% faculty found an increase in incidence of complaints arising due to patient dissatisfaction because of poor communication with them. Presently, the research endeavors for the patients act only as a permit to appear in the exit examination. The focus of the postgraduate students lies just only in the completion of the research project rather than on the core issue, its impact, its value. Thesis has its value when published in a scientific journal and add to the global pool of knowledge. Weightage in the final assessment should be given to attending conferences and presenting papers in conferences, and this will motivate students to undertake short clinical activities and thereby improve their their skills in the research domain. Travel grants should be provided to students to attend international conferences to get good orientation to quality research, and medical colleges should be attached to institutes of excellence for doctorates in medical research to avail of the high caliber guidance and infrastructure. Feedback from all stakeholders should be obtained on a continuous basis to keep abreast of the recent advances and to maintain quality. Learning is incomplete without assessment. A 360-degree assessment must encompass personal attributes, didactic knowledge, clinical skills, surgical skills, and academic performance. So this review article was very recently published in IGO, and in this review article, the authors have suggested a variety of tools that assess the diverse skills that a resident is expected to acquire during his or her residency. Presently, the current system of final assessment based on theoretical and practical knowledge does not give an overall view of the performance of the student through 2 years or 3 years. In addition to the final university examination, weightage should be given to the overall performance of the student through 2 years or 3 years, and this should be periodically assessed. Certification incorporating profession-driven standards and requirements should be granted to those who meet a series of accredited medical training requirements and complete intensive evaluation process. So to conclude, residents should have a purpose in joining a residency program other than just acquiring a degree, being part of a larger mission. Change is never easy. Change is always resisted by those in the existing system. Reforms of medical education requires more than agreement. It requires a widespread commitment to action, vigorous leadership, and political will. The National Medical Commission came into force on 25th September 2020. This historic reform will steer the direction of medical education towards a transparent, qualitative, and accountable system. Thank you for the patient hearing.
Thank you, Dr. SHIRAZ, for your good presentation. Now, I request my panelists, firstly, Dr. Saban Samanta, Professor Ophthalmology, to give his view for improving the postgraduate education in our country.
Thanks, Professor Rajiv Gupta bhai. But I think time is over. Thanks, Professor Rajiv Gupta bhai. But unfortunately, time is over. I just like to give my comments only for a couple of minutes or 3. I have my post-graduation about 46 years back, and my undergraduation ophthalmology 50 years back. Right now, what I am saying is a very shiny part of the postgraduate students as well as the undergraduate students. 70% or more are myopes. They like to read very much disciplined. Unfortunately, communication skill is very limited. Don't like to talk with anybody very much. Don't like to communicate with the patients because they are myopes, they are introverts. On the other hand, the dark side, just to recapitulate the words of my great teacher who is still alive in Kolkata at the age of 103 years and still practicing medicine, Emeritus Professor Manikumar Chhetri sir. He told all of us in his first clinical class in medicine, patients are the pages of the book. But today, even undergraduate or postgraduate students, they don't like to examine the patient. They don't like to go to the patients, but like to read very much. Because from their very KG class, they are all being acquainted with all entrance exam, starting from their high school level, from their pre-medical, medical, postgraduate, everywhere, only reading. That's why what we saw during taking this examination, whether in undergraduate and postgraduate, all of you will admit that if you ask them to show any clinical method, that's very difficult. but any theoretical part, they can utter thousands of pages. The second interesting thing, what we can never think of, Professor Vinita Singh and everybody are there, in our day, just after post-graduation, we are very much confident to have our own private practice or to do any OPD, outdoor, any charity hospital or government hospital. But nowadays, no postgraduates are there enough even to go on a single-hand practice or anything. All these things we have to think of, and we have to prepare ourselves. For this, we have prepared the Forum of Opthal Teachers of India for the first time, and we like to include all the retired as well as ongoing, not only the professors, any lecturer, assistant professor, equivalent above in that group. And we are very much, right now, around 1,000 have joined. And we are very much optimistic to have more than 4,000 within coming 1 year will join in this group, and we can discuss many more. And discussion will be mainly focused on an uniform curriculum all over the country, uniform logbook all over the country, and the most important thing, by the name of PG education program, PG course, PG training, those who are not at all teachers, giving some guest lecture or anything, but we the people who are nurturing from the UG to PG, we have to be taken into account, and our words should be taken into account. Then and then only the PG training course will be an effective one. Thank you very much. Please keep in.
Thank you. With your kind words, now the session is over, and I request all the panelists and the instructor and co-instructor to have a photograph together. Oh, okay, ma'am.
Thank you so much for initiating this forum, which is very much the need of the day. And for that, I congratulate Dr. Samanta. And this question of uniform logbook, uniform training, see, we have institutions at the top end, and we have institutions which are not so well equipped with teachers and infrastructure. But we do need to strive for a uniform training and teaching program. And with this, you know, two things have come to my mind. One was that why are we having, what is the, diploma has been almost finished. There are only some places where diploma is there, it is not there. Now we have DNB and MS, and both are giving same training, both are having the same post-training eligibility for various jobs, teaching as well as non-teaching. Then why should we have two parallel courses? What is the advantage? I think this is a big question which we should try to solve. Because that it creates nothing except that there are entirely two different streams and the training programs which are trying to achieve the same thing. We are giving them similar cognitive skills, similar psychomotor skills, and similar soft skills. So why should there be a difference? And as far as the training of soft skills is concerned, it is very recently, you know, being taught everywhere, teach attitude, teach kindness, teach communication, fine. But I always emphasize that the student learns more by observing than what we teach. So we have to be more setting examples rather than teaching them attitudes and soft skills. But I do not deny that we have to ensure that we have that incorporated in our evaluation technique. This subject is endless and the time is short, so I will stop right now. And I congratulate Professor Samanta for taking needed initiatives, and I think we will go ahead a long way with him.
Thank you, ma'am. At the very outset, I must compliment all the speakers. They were very good, and it was a learning experience for all of us. Now, I just had a point which I wanted to actually put up in front of the House for discussion. The topic's term was a pragmatic approach to teaching and learning or evaluation of residents. Now, pragmatic is realistic. Realistic, what exactly is the reality today? Well, I was involved in this SSTC for the last couple of days, and I have been dealing with a lot of residents and post-resident young MS graduates, and I was quite shocked because there were times when final year residents had not even touched the FICO machine. There were people who had finished MS and they had not touched the FICO machine. They were just doing the initial steps of SICS and all. Now, I do not blame them, and I do not blame their consultants, and I definitely do not blame the institutes, because the last couple of years have been horrible and traumatic for all of us consultants, for the residents, and for the entire world. I know Dr. Shiraj did mention some.